We're here at the lovely home of Friederike Meckel Fischer, who will talk a bit about psychedelic therapy. So, can you begin by sharing a bit of your background?
Yes, my name is Friederike Meckel Fischer. I'm born in 1947 in Germany, and I'm still German. Professionally, I'm a medical doctor and a medical psychotherapist, and with this psychotherapeutic area I entered about 25 to 30 years ago. Then I really found out that I couldn't reach people with, neither me nor my clients, with the normal ongoing talking therapy. So I learned the holotropic breathwork, which includes the body and an altered state of consciousness. And to put it very short, because we have a limited time, I understand, with this holotropic breathwork, I understood that we really need to address the unconscious, what is in the body, what then comes to the mind, and so on. And this, I learned this with Stan Grof, which naturally, very consequently, brought me into the field of psychedelics, which I didn't learn with him, but when I look at it in the retrospective, I think I at that time couldn't distinguish between what he told about psychedelics and the holotropic breathwork, because I didn't have any idea about psychedelics. So at the very end of this training I had with him, he mentioned, and he has forgotten it, I asked him, that he said maybe you should go on with psychedelics, which at that time I didn't grab either, because I had no idea what psychedelics were. So actually I happened to enter the field of psychedelics just for myself, and I then really by chance, and I guess life is a series of opportunities one gets, I had the opportunity to enter a training, relatively short, 3 years and 12 sessions altogether, in Switzerland, in psychedelic therapy. Yeah, and after that, the chances went on. I was addressed by people to do work with them, and I did in single sessions. And after a while, there were so many that I set the dates and I formed groups, and in this way, I established groups, and then time went on again, and so I did groups regularly, and all of a sudden I was in the midst of doing psychedelic therapy. And I always applied the rules that I had learned in my training, which nowadays naturally are very more sophisticated and worked on. But the general rules of psychedelic therapy I learned at that time, and so I did it. Yeah, naturally I did all this underground because, as we all know, these substances are, to put it mildly, not allowed.
But there was a legal loophole during the 90s, correct?
Yes,
in Switzerland.
Yes, there was between 88 and I think 93 till 94, there was this gap where a couple of members of the ZEPT were allowed to work with these substances, with LSD and MDMA. And one of these persons offered this education. And this is where I got in. Over the book he had written, and so this is why part of this training was in the legal time, and the rest of it was as everything. Yeah, so this is how I entered the whole thing.
Okay. Now you wrote a book called Therapy with Substance.
Therapy with Substance.
Psychedelic psychotherapy in the 21st century.
Yes.
I got it right. Yes.
Yeah, you got it right. And Stan Grof wrote the foreword, which honored me very much. Yes, I wrote a book. You may ask the question now why I was able to write a book about it. and the circumstances were not that easy as it sounds now. My husband and I were betrayed, and we were put in custody. By the way, 8 years ago, at this very time, I was sitting in jail, and I had to go for a trial, and I was fined with 16 months of prison on probation, for probation for 2 years. But for the therapy, I was charged, not acquitted of anything. So they said that I didn't hurt anybody nor put anybody in danger. So I was only acquitted for violating the narcotics law. Okay. And this naturally, it was a horrible thing to go through, to be honest. But it gave me the chance to speak publicly. And after I had sort of recovered from this shock, my husband and I went to David Nutt, and he
Professor David Nutt in Imperial
College, because we had heard of him, that he had done this drug ranking.
He was once the government advisor for drugs in the UK.
Exactly, and during the time we were in prison, he was chased away. Mm-hmm. So we thought it was like a miracle.
I think it was because he said something like ecstasy is safer than horse riding.
Exactly, and that
skiing.
Alcohol is the worst drug.
Yeah.
And all this, so one might read this chapter. And he advised me to write and to talk. Mm-hmm. And at that time I thought, dear God, how can I talk and how can I write? But he gave me Ben Sessa at the side, and so Ben Sessa asked me a lot of questions, and I answered them all, and all of a sudden I saw what I had done. You know, I had an overview and could see that there was a system behind it, and this way I sat down, and it took me about 4 years to write this book. And I have practically written it 3 times.
And it is a great book. The first few chapters especially were hugely eye-opening. Can you perhaps discuss the part where you had your first MDMA experience and the revelations that came from it?
Yeah, the very first MDMA session directly brought me into the issue that then I found out that had sort of driven my life, and was the very early death of my father, which really, the way of telling me the shock that he wasn't there anymore brought me into a complete, I would say, a long life dissociation, out of which I functioned pretty normally. But behind this was an enormous shock and a trauma, and a deep sadness. And with the psychoactive substance, over the years I worked really through this trauma by reliving it, and this gave me the total understanding of how trauma works and how these substances work, and how we can by knowing what was bothering me and guiding my life subconsciously, I could transfer the knowledge of myself, combine it with the knowledge that I had of a psychotherapist and the tools that I had as a psychotherapist. So I could really apply what I have learned by myself and apply it to others with the tools that are known to be effective in psychotherapy.
So the trauma of encountering your father dead was buried so deep within, and MDMA helped to uncover it and face it head on. Now, last time I saw you mentioned that MDMA has the effect of sort of disabling the amygdala, which is responsible for fear, and you can face trauma.
Right, without being overwhelmed by the upcoming emotions that are directly connected as a reflex to the trauma. So when you take the MDMA, then you can sort of look at the things, understand yourself, the surroundings, get a deep empathy for yourself, and then you can say after a while, okay, this has happened to me, and I can feel the feelings that I couldn't feel because of the dissociation. Naturally, then with other substances, one can say with the MDMA, you can look at the trauma, the anxiety, the reflexes go away, you feel more self-confident, you feel that you are able to feel, you feel that you are able to love, you feel that you are lovable yourself. But then I found out during the ongoing time that, for example, with LSD, you can look at the same, you go into the same trauma, and you can relive it on a different level.
On a different conscious
level.
On
a different conscious level, or with a different focus. And then again, and it was very, I was already 60 years old, and I went to Brazil, took ayahuasca, and all of a sudden this sadness that I had already experienced with MDMA showed up again. And it was a much deeper sadness. And with the ayahuasca, I cried my head off, and only after that I can now look at this loss, and it really is over. So the MDMA does a lot of things, and I think for most of the people, it will be enough to do the MDMA and come over it and live a normal life again. Mm-hmm. But for me, I knew just something was still sitting there. So I asked the ayahuasca to please relieve me of the rest of the pain, mm-hmm. you know.
Yeah. That was actually going to be my next question. You used several different tools from LSD to psilocybin, 2CB, MDMA, but in your book you state that ayahuasca, you put it above all other psychedelic medicines. For what reason? Some people say that ayahuasca is the only one that really touches on every chakra.
I would say so too. It reaches, well, I mean, the active substance is the DMT, yeah. So I think whatever substances they are, containing the DMT really takes you down to the deepest level where you meet life and death. And I had many sessions, not only I, but people around me too, that really got there to the deepest level, and when you have gone through that, then the thing is solved. Mm-hmm. So, and I found this really with the ayahuasca, the precise, most precise, you know. Mm-hmm. I still would say that for normal psychedelic therapy, you know, the MDMA is the really the first one. Mm-hmm. And then
being the safest.
The safest, the one that doesn't demand so much of the mm-hmm. client, because mm-hmm. if you have never taken a psychoactive substance and you immediately start with ayahuasca,
might be overwhelming
it
amount of information to process.
Exactly,
yeah.
You might really be re-traumatized because you can't handle it. One has to learn how to be with the substance. And so when I take ayahuasca, I know, even when I have the feeling I'm far out, I know how to guide myself and to ask the question and to stick with the problem and to really ask again. And if I don't understand, I ask, please let me see it again. So it is an inner work, an own inner work. So I am like, the plant is my therapist, and I talk to the plant. As we say, psilocybin and ayahuasca are teacher plants. So this is why I say it reaches the deepest, because the process is really only within yourself, you know.
Mm-hmm. So what advantages do you think psychedelics have over conventional medicines and alternative medicine practices?
Well, the effects of the substances, which I, as a psychotherapist, simply call the widened consciousness. You know, when I see the pictures where all these areas of the brain are connected, then this is exactly what is the advantage. It connects everything and it opens up so that one can have a direct view into what is otherwise not reachable with the normal conscious mind. This is the only real advantage. And people have to know, and I don't know really how to spread this into the world, all one sees on a psychedelic is just the own inner thing. Whatever you see, even the so-called pseudo-hallucinations, they are pictures of the own inner thing, and this is the advantage. If a person can really grab this, we will have no bad trips, because every horrible thing we see, we don't call a bad, but we say, oh, it's me.
Yeah. There's too strong an association between the individual and the thoughts.
Yeah. Exactly. And the interpretation of the perception is what then makes the horrible thing. If I see something, I say, oh yes, that's this and this, or if I react directly because I interpret what is there as to be horrible, instead of saying, oh, this is that. And I think the intake of psychedelics under this knowledge allows really to look at everything there is and say, this is mine, and there is a side that I haven't seen yet, so it's mine, I take it, and then, it's like the work, the shadow work of Jung, we could say. But it's much more vivid, and it touches one personally, and this is the advantage of the substance too, that it touches you on the level of feeling, understanding, and sensing your body. It really reaches all three levels. And then when you do something, when you move, you express yourself. Like on LSD, you all of a sudden you tremble or you react, and those are memories of the body that come out, and we have to understand them, and not say, oh, LSD makes you nervous, or it's all an expression. So taking the substance leads you to express yourself totally, to understand with the altered consciousness, to express yourself.
Now, last time we met, you also mentioned how trauma can be stored in the body. So the initial trauma of an experience can get lost from memory, but is always stored and becomes fragmented and stored in different parts of your body. Can you elaborate on that?
Yeah, imagine a child in the womb, and the labor starts, and the child has the umbilical cord around the neck, and every time labor contraction takes place, the child wants to get out, but if it gets out, the umbilical cord gets tighter, it suffocates, so the body gets into a stress, a horrible stress. And then the child cannot think, oh, I'm in danger. It is a biochemical thing that happens. There is no oxygen. The body starts wants to get out, but can't. So what happens? The movement, the reflexive movement of get out here can't take place. But the stress is stored all over the body and naturally imprinted in the brain in fragments because it doesn't enter the hippocampus, which would then install a memory.
Yeah.
But the body, the reflection. So in trauma therapy, we have to come to the point where this unfinished movement gets out, because the try to get out is imprinted too.
Mm-hmm.
So on a psychedelic session, you might all of a sudden find, I think I read it in my book or in the last talk, the trembling, which is a normal getting rid of this stress in the body, or the moving out, can get out, and then it is out of the system. This is why I really urge that every therapist who works with psychedelics is very much knowledgeable in trauma therapy, the phenomena of trauma that appear on sessions, and how to deal with this phenomena, because they have to get out and not to be seen as a side effect of the substance. And it is important to understand these phenomena. You know?
So a lot of people can have behavioural problems and psychological problems that stem back to a traumatic birth experience, and will never know, will go their whole lives without having any idea where this psychological problem comes from.
Exactly, one can read this already with Stan Grof. Naturally, I gave this example of the birth experience, but there are others. You know, when we were arrested, I just recall this. I was standing in the door of my bathroom, and I saw all these men, and I heard a voice say, "You are arrested," huh? And this moment I had I wanted to get away, but I couldn't, and I watched really, I noticed how something went out of my body, and my heart was beating about an arm length of mine. I could feel my heart beating out of my body. And then, naturally only afterwards, I knew that the moment of fight or flight couldn't take place. So I dissociated. Yeah. And from this moment on, I was
You let go of the fear?
No, there was no fear. It was a reflex.
Okay.
No feeling, no fear. A shock, fight and flight couldn't take place. So I dissociated, and from this moment on I was totally calm.
And you just fully accepted the situation?
No. There was no reflecting point of I have to...
Oh, you mean you got so dissociated from
so
your
that I functioned.
primal instincts?
Exactly.
Okay, yeah.
This is the typical... So I understood dissociation just like that, you know. That now I had really lived, and nowadays I can see in clients when they sit here and I say something, I see how they dissociate, you know. And then I know what I have to do. But this is something that this is why I give this example. On a psychedelic session, people dissociate. And we have, as therapists, we have to see that. Many people, or some people said like, oh, I don't feel anything. On a session, full of ayahuasca, or they say nothing happens, you know, they get a booster. No, they are in a dissociated space. So if you give them more, they will get out and not work on what dissociated them, so that they can reconnect.
So from that dissociated position, they're a vantage point for dealing with trauma, because they can view it without the fear and the
but sometimes,
the emotions.
But sometimes they do not get to this dissociation. You know?
Would that be because the ego is too strong and they just
No,
get caught
because it is so separated. You know, the things that lead to dissociation do not go via the hippocampus that gives a memory. And so these trauma aspects are really located, fragmented. And sometimes you have the good luck to hit a dissociation point where the client says, oh, there is nothing. And then it is the therapist's task to stay with it and gently get him out of this dissociation. And it always looks very different. Sometimes a touch and staying with him is enough. Sometimes I would say, what else do you hear? Because the other, what is it called? Eye, ear, perception tools work. Then what still do you hear, or do you see anything? And then they look inside, and all of a sudden they say, oh, I hear this. And then all of a sudden they are there. Mm-hmm. So one really has to carefully deal with this. You know, and these phenomena show up on psychedelic sessions. And that's, again, an advantage of these substances, that you can reach these points and work them through on the session and then reintegrate the dissociated part.
You mentioned, I addressed the phenomenon, so-called phenomenon of flashbacks with you once before, and you said that there's no such thing. Flashbacks are literally unresolved trauma.
Exactly. Yeah. You know that in a normal trauma, sorry, but you understand, you have flashbacks all the time.
Yeah, yeah.
And
I've only ever had flashbacks from a bike accident I had.
Exactly, this is what
Every time when I was falling asleep, I'd relive the moment and I'd be...
This is a flashback. If you have a flashback of a session, then there is an unresolved issue that showed up on the session. So Stan Grof already, he wrote this book in '85, says if you knock down a flashback of a session with, let's say, Valium or something like that, then the flashback will push up again and do more and more. The moment you leave the sedative medication away, it will pop up again, and then psychiatrists say, oh yes, the naughty drugs. So Stan even, I think he even recommends, I don't know it for sure, but he recommends to do the same substance again and then get it out, you know, and
which is the last thing that most people would ever want to do.
Exactly. Okay. I haven't dared this ever, but in holotropic breathwork, then we really go again, or with the EMDR that I have learned by now, we go exactly to this session, to this moment, and catch it and do it, you know.
Okay. So it seems to me that regarding the legal status of psychedelics, they're pretty much all Class A or Schedule 1, with the exception of ketamine. It seems that it's in the best interest of pharmaceutical companies and governments to keep them illegal, because take MDMA, for example.
You take it a couple of times.
Yeah, just a few times, I think up to 4 sessions within a month.
Yeah.
And in the latest MAPS research program, they showed it to have about a 82% success rate at curing PTSD a year later. So 1 year later, the individuals that went through the study were 82% were completely free of PTSD symptoms, and that is unheard of in Western medicine.
Yeah.
So that's not really a profit-making scheme that these pharmaceutical companies would be interested in.
That's right.
Bearing that in mind, do you think that this will ever become mainstream as part
Yes, I do. As a matter of fact, in today's New Zurich Zeitung, NZZ, again there's written an article about veterans, and that it is about, you know, PTS people, how many kill themselves each day, and for some reason I think that the psychedelics will win the race in the end, and because what makes me say this, if I watch the world producing victims of trauma every day in such an amount, that if I would be an advisor of a pharmaceutical industry person, I would say invest in this, because we produce intakers every day in a mess. So it's right, but I think it's short-sighted to look at it that way.
Yeah, I think
even under the money aspect, you can earn enough money with all these if you want to.
But short term, it would, if they were introduced now as a legal therapeutic method, it would cause too much of a disruption to the current social and economic climate, particularly in medicine and healthcare. Yeah,
well, I think you are right. And maybe I may add some thoughts of my own to this. I think we have to really think about the psychoactive substances as working on this body, mind, soul level, and the reducing it to medication. And I think as long as this philosophy that, or not the philosophy, the knowledge that body, mind and soul are the same, and this knowledge has to be spread. So in that case, then we could, there would be another attitude behind the substance-supported therapy. And I don't know whether you can get the connection that I make.
Yeah, there. I think we need to let go of materialism in a way.
Exactly.
And psychedelics have the added benefit, you might want to call it an accidental innovation, in that they do help people to let go of materialism, to not think that material reality is everything.
Exactly. And if we can get this more into a common knowledge, I think then the page will turn somehow. But it's naturally not a materialistic thought.
It's too easy for the media to put a negative spin. I mean, they could have 10,000 people cured from PTSD using MDMA, and then one have an adverse reaction, and the media will...
Exactly. Yeah. And so it is really a question of how do we get the word spread that psychedelics used as medicine or as a meaning or a means to recovery and healing or to a spiritual path is different from a drug. And I think if we get this word spread in the head, especially of people that have influence, then there can be a change. Because we all are working, from what I perceive, there are the universities that are working, researchers are working, in the jungle people are working underground, so everybody is working, but it seems to me that there are two different groups of people, and the ones that rule the world keep the others like in a cage. In this cage we can all move perfectly.
It's like they keep us all domesticated, like domesticated cattle.
And every time I'm on a congress or give a speech or something, then I feel these 4 days, I feel free and I think, oh yes, we got it. And then I get out and think, oh, I only was in a different cage. So to get these people together,
connect,
and really understand, and I think that Rick Dublin is really trying to get there. And I would wish that more and more journalists, researchers try out in a good setting themselves to have own experience and then understand something and change their minds.
There was an interesting podcast done by Joe Rogan and Graham Hancock where they said that every politician in high office should have to, at minimum, go through 10 strong ayahuasca or psilocybin sessions.
The world would be a different place, And I think the journalists have a real important task, and they could spread the word. But you cannot talk about a pudding and the taste if you haven't eaten it. So it's as simple as that.
Yeah, I think another problem is you hear a lot about charlatans as shamans.
Yeah.
That are really they're sort of like egomaniacs, and they become shamans, and they take advantage of their position, and they haven't got the best interest of other people's health at heart, it seems.
Yeah, but see, I don't understand much of that, but I think we will always have to do with it. Mm-hmm. And we can ask ourselves what it is good for. It is good for distinction, to find out, like you follow one of these charlatans. Then if you really come to the deepest inside, you will find out that the person that follows has made an inner decision to follow. Mm-hmm. So the person will have its own experience and then be able, hopefully, to decide. So I really, truly believe in the self-verantwortung, responsibility. And we know deep down, we know exactly what we do. All we have to do is investigate ourselves, put question behind question and reflect and find out what are we doing there, who is he, who I am, does this do me any good? And then we cannot forbid other people to do whatever they do. Mm-hmm. Even if they harm other people, everybody has his very own responsibility. We can tell someone, please be careful. Or we can say someone, you are not doing right. But who are we? It's a difficult question.
What advice could you give to someone who has untreatable PTSD from, say, military service or childhood trauma, who feels that they might as well give up because they've tried all conventional methods and nothing has worked? What advice could you give to them?
Well, first, naturally one can I would not say immediately do MDMA. Mm-hmm. I wouldn't do that because it is still illegal, and so I first advise trauma therapy. I have by now learned the EMDR because it's a very, very good method. And with some people, a good trauma therapy that includes the body, like Peter Levine and Bessel van der Kolk describe it very, very well, and the EMDR, a lot of people can profit from that and get over the worst situation.
So EMDR is eye movement?
Eye movement desensitization and reprocessing. And it is a bilateral stimulation so that the synapses in the brain, by the vivid movements of the eyes, get sort of torn apart. Mm-hmm. And by very slow movement of the finger where you follow, you can then put an anchor, like for example in the what is the method called? NLP. You do the same.
Neuro-linguistic.
Yeah, you put an anchor so that the person can help himself. And I do the EMDR here.
So exactly how does it work? The therapist goes at that, and the patient follows
only with the eyes.
For how long?
I do 25 things. 20 to 25 things, and I watch where he is. If the eyes stop.
Does that make the brain go into like a hypnotic trance state? Or?
No, it is supposed to sort of tear the synapses apart that trace this difficult moment. You know, and very often when I do this, then memories come, or they start sweating, and then they stay with the sweating, and I do it again. And after a while, the system calms down. If it's necessary, you install a safe place beforehand so that they, if it gets too heavy, can move to the other chair and be on the safe place and recover, and then we can freeze the problem. So it is a very good method to deal on the in a medium time, long run with a traumatized person. and the body work naturally. I'm not, I do not have a total completed education in trauma therapy, so for this I send people to other places where they can do this with the stepwise dissolving of a trauma, and I really do think it works.
And the book you recommended, I actually started reading it.
And holotropic.
The Body Keeps the Score.
Yeah. This is Bessel van der Kolk that I just mentioned. The book is very readable. Yeah, and I learned a lot from it. Not things that were new for me, but it was put into words, so that I understood. Oh yes, this I've seen. I have seen all these things on sessions and dealt with them, like I had learned with Stan Grof with a body work, and I had done EMDR about 15 years ago already, and only did the basic course, so I knew somewhat about it, but I have refreshed it now and do it. So I would recommend someone to do these. To do the holotropic breathwork.
What about hypnotherapy?
If the hypnotherapist, I tell you, I am educated in both ways, in the classical hypnosis and the Erickson hypnosis, and I, to be honest, found out that with the Erickson hypnosis, I don't get far with traumatized people. The system shuts up the moment it gets. And with the classical hypnotherapy, well, I'm not that. I know one can reach traumata there, but not as profound, I would say, as in the EMDR. One could try it because every person reacts differently. It depends on if you have a traumatized person. If he's traumatized when he was adult, you reach the trauma sooner than with one who has a child development trauma. So
I have a friend whose mother went to see a hypnotherapist because she was very depressed and lonely after her husband passed away from cancer about 6 years ago. And the last session she had with the hypnotherapist, she said she has no self-esteem, she is very depressed, lonely, and the hypnotherapist said, you need to make yourself the center of the universe. And literally, like that, from that moment on, she became extremely egocentric and just self-centered, and has since become bipolar. And she seems to literally put herself at the center of the universe, and it has had not a good effect. So it went from being depressed and lonely to being an absolute egomaniac, and now she has bipolar disorder. And my friend thinks that some form of psychedelic therapy would benefit her to really break the ego.
I tell you, this puts me into a difficult position. I would not dare, or would not have dared, to treat this with a psychedelic. See, naturally, one can assume that nearly all psychiatric illnesses are the result of a trauma. Right. But for me, I always distinguish between I have a disorder or I am the disorder. Not very academic, but the personality disorders and the bipolarity, they are traumatized so severe that one would have to change nearly every cell, really. I had this insight once when I tried to find out how one could treat a whole sick system, and the answer was that all cells would have to vibrate again in a new rhythm,
harmony.
And I don't know how to establish that. Maybe
some sort of stem cell replacement therapy?
I have no idea, but there I can really not say anything worthy because I just don't know.
So there are certainly people who should avoid psychedelic therapy.
Yeah, and one has to try to get them with other methods into a livable life. You know, psychedelics are not the solution for everything. I think we have to really know our limits and to know the circle of competence.
Yeah. I met 2 psychiatrists recently who had been in that field for the best part of 40, 50 years, and they got into hypnotherapy towards the end because they said that the conventional methods just are completely pointless for many people. Yeah. And one interesting case, both psychiatrists said that in many cases they'd refer the person to whatever kind of religious background that person is from, to like a priest or a rabbi rather than a doctor. And one of the psychiatrists discussed one of his patients who seemed to be so attached to a particular identity that was malevolent, that was very destructive. And he under hypnosis he said, I want to talk to the real you, deep inside you, there's the real you somewhere. And the 22-year-old from within the woman, she was in her 40s, the 22-year-old came out and spoke and said that she's been trapped in deep within and hasn't emerged at all in the last 20 years or so. And it seems that this is way beyond conventional medicine.
No.
No.
No. No. If you read, wait. How do I explain this? It refers to the work of Ellert Nijenhuis. At least this is the association I have with it. You must know that if you have experienced a severe trauma, what your system perceives as a severe trauma, and the earlier, the worse. So then, within your system, the emotional person, they develop or establish different parts of a person. So we talk of an ANP, which is called in English apparently normal person. That is the part of the person that functions, that can learn, love, have a husband, children, do a study, go to work, have a bank account, do tennis or whatever. And then, because of the trauma and the fragmented parts we talked beforehand, they establish as EPs emotional personality parts. So Ellert Nijenhuis, for example, works with these parts, and we know that these parts interact and influence each other without knowing us. So in psychedelic, my psychedelic work, I have seen these aspects. For example, a woman, I gave the example in my last talk, by the way, in, where was I? In Breaking Convention?
Breaking Convention, London.
Yeah. I talked about these phenomena which we have to detect on the session. There is a person that says, that's not like me, and all of a sudden she is aggressive or whatever. And then you can sort of talk with this person, and what I did then, coming out of a family constellation, I would put a person next to her and being this part, and would try to get them together, as we do in regular family constellation too. We work with parts, or there is this therapy, my goodness, just a second, that works with different parts of the body, not of the body, of the person. So in hypnosis you will see the same. All of a sudden you can talk to this part. And what we have to do is then get this part and put it in the A and P, so that the person gets reconnected with all its part. It's a dissociated part, the one that flew out, which I had on a session to catch again. I had to catch the part that had left my body.
Yeah.
So this hypnotherapist is totally right. Mm-hmm. He should interconnect with different ego state therapy. This is what I was referring to. Ego state therapy. They work with the parts and with the so-called EPs, and you have really to take these parts very serious. In psychiatry, then they talk of the multiple personality disorder, and so you can have a couple of them. And the book of Elliot Nijenhuis, it's about this big and almost not readable, but I took a course with him. He talks with them, and so one can talk on sessions to them too, if they get out and you can identify them. Mm-hmm. And in family constellation, we work with parts.
Now, I mentioned earlier that I'm more familiar with Eastern mystical and Buddhist traditions than Western psychology, and they often refer to the mind as being Maya. The mind is an illusion in Buddhism, and it seems like that approach could be very beneficial for psychological problems and mental health, because in a lot of cases of schizophrenia and bipolar disorder, depression, people are so strongly attached to their thoughts that it becomes who they are and causes the affliction. And just that statement, the mind is Maya, the mind is an illusion, can really help people to see through the illusion of the mind. But obviously, if we give up on our ego completely, we can't function in this everyday society.
Yeah, well, that's a wide field you are heading to. First sentence: to have an ego delusion, you have to have an ego first. Mm-hmm. So you have to be aware of this ego, and what you are saying is true. But how long would you have to sit for this on a meditation?
It requires a lot of discipline.
And you enter this state of where you are one, where you are not your mind, where you are not your body, where you are just this core you, core I. And this is a healing moment. I think we have talked a lot about the really healing factor of a mystical experience. Mm-hmm. That's very true and very right. It is very healing to reach this point. But this point is, you cannot say, I give you this and that, and you please have a mystical experience and be healed. It's a very good idea, and these things heal, especially the insights you have with it. The things are not that important, and I'm taken care of, and I'm I know that I'm held within something that is bigger than I am. So what we would call religio, rebinding to what is greater than we are, and to be in this. Just to be held, to be sure within ourselves and the environment we are in. And that's a mercy to experience this, and it will stay with you, and you can reconnect to this over and over again and remember it and say, I know I'm held even though I feel now awful. This is another very important aspect of the psychedelics, that you do these, that you have the mercy to have these experiences, to feel what you can feel, to feel safe, secure within all this, without any therapeutical intervention, and then you experience it yourself, and then it is sure, because it doesn't come from the outside. That's the healing effect of the substances too. We cannot stay in this matter of state of being all the time because we have to function, you know.
Okay, so back to the mystical experience state. We can't stay in that state all the time because obviously we have to function, and having to fit in to the modern society with all its stresses and strains, you really need the ego to take control a lot of the time.
But having experienced this will change your attitude, will sort of be aware of the ego that you have. Then you can, it's a long process to become less ego oriented. It has to do with the ability to be aware of projection, to be aware of your own emotions, and take everything as it is. So in a way, it is the Buddhistic or the Stoic way that the psychoactive substances can lead on, and that you then have to practice during everyday life, because the real integration is the everyday life, you know.
So what exactly might someone experience when they undergo a mystical experience in a psychedelic or non-psychedelic state? And how can it benefit?
Well, at the moment you, within a mystical experience, you understand something that cannot be put into words. But that will change your view, your attitude, your behavior. So that you are sort of free of all these prisons you are in, you know. And one of the items of a mystical experience is the unexpressible. And this is what I'm referring to. It gives you the feeling of this is true. It gives you the feeling of I'm held. I am now, according to the religion you come from, my mystical experience, I was finding myself in God's hands, and ever since, a lot of my fear is gone, just gone. And I still have fear. If I think of whatever, then sometimes I even get into this dissociation of the arrest. But then I can remember and say, I know I'm in God's hands, you know. What can happen to me? Not that I'm not careful when a car comes, but deep inside there is a confidence and a sureness of the knowledge that you have found, and this is very healing.
About 10 years ago, I had a near-death experience in India from illness. I had dysentery and I was extremely dehydrated, and I passed out twice, a blackout, and then the third time I passed out, it was a whiteout, and it lasted several hours, and I completely dissociated, and everything disintegrated, this whole reality, and it lasted several hours, and I experienced a oneness. I completely lost my identity, and I became at one with everything. And as I slowly came back, I saw myself from a distance, and I was like, who is this creature that I occupied? And had these ridiculous thoughts. And it lasted about an hour to get back into myself. And I saw myself from a distance and realized the thoughts are not who I am at all. And the body is not who I am. What I am now is greater than both.
Exactly. Yeah. This is what I was just trying to express, you know. And
I did lose a lot of fear then, like the fear of death.
Exactly.
And I had a similar experience a few months after that with 5-MeO DMT, which was almost identical but only lasted 20 minutes.
Yeah. Well, this gives the proof that the psychedelics give the same experience as the experience can be without.
Do you think it could be from an endogenous release of DMT or 5-MeO DMT?
Yeah, I think so. Birth and death are supposed to really be driven by DMT.
The one thing I took from them several weeks after both experiences, I had this incredible inner peace.
Yeah, that's right. This is exactly when I get into this fear, reading something horrible about, what people say, and so then I can really lean back and say, okay, what do I know different from that? And then I can come back to this inner peace. And even when I lose it sometimes, I can always go back there, knowing. So what is important, that you don't lose consciousness on a psychedelic session, but that you can really integrate it in your body and in your rational mind too. I know this, and if I forget it, or if it gets lost because of stress, I can remember it. So you have to go through these structures of the brain that take care of memory.
I think it also gives you a reference anchor point, like you literally died and came back.
Yeah.
And nothing is as bad as dying.
Yeah.
So then why worry about anything?
Exactly.
Really,
Yeah. Well, I had an experience like that too. I was sitting in a concert shortly after the release out of prison, and I leaned back and I listened to Chopin, and I relaxed for the first time, and all of a sudden I saw myself from outside, from above, sitting in the cell. And then I knew there I have to do work. So again, I went to Brazil, and I asked the plant to work with me to get myself back together there. And I think one day I will write this down, because it was the most difficult work I'd ever done with myself, you know. I begged this part to come back to me, and it wouldn't dare to come back. So I think I took a booster for the first time to get it, and I managed. And this, as a matter of fact, I don't quote this often, but this getting myself back together again indeed was a shamanic work, you know. Catching part of the soul. A psychiatrist would call it differently, but this is really when I understood what I think I finished. The last chapter of my book talks about the parallels between psychedelic work and shamanism. Naturally, one has to be careful with the expression, because, you know, it includes a lot.
Yeah, it's a very taboo
subject,
especially in academia.
And it's used so often inflatorial that I'm very careful with this. But it was the association I had at that time.
And how important do you think the music is to guide through the process?
Very important.
I often find that in ayahuasca ceremonies, I don't purge unless the music goes dark and.
Exactly.
Some ceremonies they just play happy music, and I'm just like,
you can't. No. Well,
it's incredible the emotional response.
Exactly.
From the music.
Music is an extremely important tool, and I think that the music should, in a way, guide the process, but not manipulate. It's quite a line, and from what I understand, or what I did, is that I really followed the unfolding of the substance. If you can take MDMA, LSD, 2CB, they have a very similar way of opening. You know, they start here, they open the pelvis area, and then they go through the diaphragm on the body level to the heart, and then here. And when it enters the pelvis, it's a little difficult, and when it goes from the lower part through the diaphragm, if you are not really relaxed, you feel a little sick, and here the people start to swallow. And this I would accompany with dark music here, with uncomfortable music here, you know, dissonant, not very with unpleasant rhythm too, you know, like Terje Rupdahl, for example. He's a typical, or Giger, he's a typical composer for second piece music. First piece I would play like you enter something, you know, rhythm, 1 2 1 2 1 2, and then without rhythm, dissonances, And if it goes from here to here, in this piece you have to have a solution in a harmonious but not too soft way, you know. And then it goes slowly up here, and you still have some dissonances because the movement goes from this is my ego and my will, and this is I open up and I surrender. You know, on the MDMA, for example.
Yeah, yeah.
So you play it according to this way the unfolding of the substance shows within you and in the brain, and then here you really play a piece that is underlining the opening and
Heart opening.
The heart opening, and then you go through here and where you would play something melodious, and here you would only play a gong, you know, a sound that opens up, and you can practically do the same with LSD. And I would never play, you know, rock or hard music because this is too stimulating. In former times I used to play a piece with words on the peak, but I have then, you know, moved to songs or string instruments without words, so that one wouldn't manipulate.
And what do you think are the differences between the plant medicines and purified chemical extracts or like LSD? Do you think there's a difference?
Yeah.
A lot of people talk about the plant spirit associated with ayahuasca or iboga or psilocybin mushrooms.
Yeah, I can really feel the difference. You know, the plant medicines, I think one really has to learn to give up resistance much earlier, because otherwise you really feel sick, and to learn to do this inner process of reflecting and sort of talking, as I said before, with the plant. Whereas the LSD I perceive to be in the beginning. I perceive it to be very intellectually enlightening. You know, all of a sudden I understand things, and I can look through the angles and understand combinations and so on, even on a psychological level. You know,
very cerebral.
Yes, and if you then don't talk too much, or it gets to the end, you have the same like with MDMA. It's a heart opening, it shows the feelings, and then it doesn't feel so chemical anymore. But the plants are different. I think the therapeutical interventions can only be on the descent, and the process, the inner process of the client has to be managed by himself much more than with the others.
Yeah, the way I see it is that the plants bring you much closer to nature, and nature has a way of balancing out. So everything eventually becomes balanced out and harmonized in nature, and I feel that's the effect that the plant medicines have on my mind and body.
Yeah, naturally there we come to the setting. You know, if you would take ayahuasca, we have done it down here 15 years ago. But when we do it in Brazil, it is totally different, really. Naturally, if I want to look at something very psychological, I wouldn't go out in nature, because then I would fall in love with the nature, you know, and it's a different setting. You have to know what you want. If you want to do something very psychological, then you stay there and maybe you go out afterwards and then connect with nature. Or if you want to connect with nature, you go out first, you know. So I think it's a question of what do you want what you want the function of the substance to be, and what is the purpose of the session, and what shall come out.
Something I noticed with ayahuasca is I've suffered from terrible insomnia my whole life, and I realized in recent years that it could be aligned with my gut functionality. Like I suffer from terrible constipation when I'm stressed or And that goes hand in hand with insomnia and low energy and inflammation.
And depression most of the time.
Yeah, and ayahuasca seems to just clear me out in every way possible.
We come back again to always the same sentence. The being together, inseparable of body, mind and soul. Yeah. And the ayahuasca works on all three levels without us making a big fuss on it, you know.
And it's been proven to flush out intestinal worms. They absolutely hate ayahuasca. Yeah. They just eject, eject button.
I think not only worms hate the taste of ayahuasca.
Yeah.
I'm not a worm, but the thinking of it makes me already a little nervous here.
Yeah. Sometimes when I walk past like a coffee shop, I kind of get a faint whiff of ayahuasca.
Yeah, that's right. No, it's. I think it takes a lot of courage to take ayahuasca, and a lot of dedication to like it. Yeah, but it's a great tool.
Is there anything you'd like to add?
Let me think. What have we talked about?
We've covered quite a lot. Perhaps the distinct differences between LSD, psilocybin, 2CB, MDMA. How would you decide which one to use for a particular individual?
Well, for beginners, whoever would come for the first time, I would recommend to always start with a lower dose of MDMA, because you never know, is he possibly a non-responder or a slow metabolizer? You don't know, so be careful. Start with a low dose, like 80 milligrams or something. And then for the LSD, I've written this too, but I say it again, I would always introduce LSD in a low dose as an adjunct to MDMA, so that the loving care of the MDMA is a little the sweetness is a little taken away by the LSD, and the person gets an idea of how LSD might work without being thrown into something that he or she isn't able to tolerate. And then, as I say, we shouldn't take the same substance over and over again, because the resistance grows up. The opening is not that anymore. So I would recommend one.
You think that's related to the ego?
Yeah.
The ego is always one step ahead.
Yeah. Exactly, and resistance of the system, which is quite reflexive, that you can't. So then I would take the LSD, which gives you clear insights, and with the LSD you have to learn to be with the substance. So to really either sit up or lay down and not react, and watch it like you are in a movie, and so low doses of LSD, like 50 to 75 micrograms, to really get to know it. So if I would have a person with a trauma or a severe problem, then I would first take MDMA, then in a second or third session give LSD. And the 2CB, the 2CB is, I like it in a way, because it is not as sharp as the LSD. It is not as sweet as the MDMA, and it has a little of the length of the tempo of the mescaline. So when I wanted to really look deep into something that I didn't really want to look at, then I would give people 2CB, to look at the resistance they still have, especially in the body. So what I gave at that time was I looked at the issues that were in the majority. If we had a lot of resistance in it, or a little stubborn, then I would suggest we start with the 2CB. And the landing in 2CB is a little awkward, So one can give a tiny bit of LSD on top, and then the landing is nicer, or a little bit of MDMA.
Okay. And what about mescaline? Have you ever used that as an?
Very rare, because it was so expensive, and the mescaline takes very long. It's years ago, but what I really liked, I with mescaline, I had the most mystical experience. I was just in the light, and it was so silent and so calm, and the tempo of the insides were very. I felt very comfortable with it, you know. Great things. As a matter of fact, it is the queen, you know.
The king being ayahuasca.
Yeah. So since one doesn't visit the king or the queen every day, you know, one can take, or you know, refine oneself all the time, more and more.
There's a phenomenon that's pretty significant with psychedelic use to overcome addiction, especially iboga and ayahuasca, that say a heroin addict or alcoholic, they're right in the deep in the grip of the addiction, and they'll do an iboga or ayahuasca session, and immediately after they have no withdrawal symptoms.
Yeah, I have seen that. As a matter of fact, in springtime, we went to Africa. It was a very peculiar
experience.
Experience, yes. We went to a clinic. I'm not addicted, but I heard this doctor talking on the conference, and I said to myself, before I die, I have to do that. So I better did it. And we went to this clinic, and really we took iboga under the clinical precautions. It was a strange experience, I have to say, and I don't think it was very typical.
Was it iboga or ibogaine?
It was iboga hydrochloride.
Okay.
And we saw this clinic was in an old house, and we saw all these inscripts on the bricks there that all the addicts had written, "I'm now totally free," and so. But and I believe this immediately, because we talked to a few.
Was this in South Africa?
Yes, in South Africa.
Minds Alive.
Yes, Minds Alive.
Oh, okay.
But I had to criticize something at it. You know that in my former life, first life, I used to be a senior assistant in a psychosomatic clinic for alcohol addiction. And we really did a lot of work there, naturally not as deep as the iboga would do. But what I missed there was the aftercare. So these people went right back into their old surroundings, and we know that habits, music, clothing, peers, living, money, family, it all gets you back in no time. So if I were 20 years younger, I would have established a clinic right next to it to do the aftercare and really get because they were really free of their withdrawal symptoms, really, and full of hope that they wouldn't get back, but they get back because the outer habits are there, and then you get right back. So this really, I was very sad when I left there, because I can see the potential of the iboga, and we had this talk on Monday about it, and I could underline every single word he said. But if we do not do aftercare and get them on a different track, they can do it over and over again. And I wish we would really have this in our areas here, and would find something that would treat alcoholism. I really wish.
The integration is
the
just
integration
as
and the work and the accompanying afterwards, taking by the hands and say go. It's a one-to-one thing that you have to really be with the client, which in psychedelic work is easier because you don't have that much.
Mm-hmm.
Many.
Having worked at an addiction clinic in London, the clients would generally put them through primary, then secondary, then tertiary. And primary and secondary, they're in the actual rehab centre the whole time, and that's like 6 months each.
Mm-hmm, exactly.
And then there's tertiary when they're outside in the community and they visit every day or 3 times a week.
Exactly. We had the same in the clinic. Not that long, because it was a clinic for people of the upper class. Mm-hmm. With alcohol addiction, and we had a program of 6 weeks, and with the last 2 weekends they would go home to approve themselves to stay sober, and then they would come back, have tests and so on, and something like this there should be, because the iboga is so potent, mm-hmm. that I think it is bad for the reputation of the plant that they have relapses. There should not be relapses, full stop. Mm-hmm. And for this, somebody has to take care of.
Okay. It seems like
otherwise it's making money.
Yeah.
Sorry.
Yeah. It seems like the integration, the primary, secondary and tertiary aftercare with psychedelics, if they were combined with that model of integration, it could catalyze it all into mm-hmm. a much shorter time period, rather taking a whole year and costing in the UK about £30,000 mm-hmm. on average. Per year, per person. It could all be.
You are so
condensed.
Right. I don't believe in this long term either, mm-hmm. because people get away from work. Mm-hmm. In our clinic there, it was said 6 weeks, because some of them had their own business or were teachers and doctors and whatever, so that they didn't go out of the earning money mm-hmm. and the society thing like that. And combining this after the withdrawal, then do therapy, and then do some psychedelics. It would be great. I would be the first to go there as a therapist. Mm-hmm. Great work we could do.
Now, I have one last question for you. Taking into account that, like, iboga and ayahuasca especially have shown like almost miraculous cure potential, so the addict no longer has withdrawal the following day. Do you think they'll ever find the neural correlates or biological correlates for that, or is it beyond like mechanistic scientific approaches?
I cannot really give you an answer to this. My thoughts are about that. Becoming an alcoholic is a very good solution to not feel what you want to feel because the trauma was too hard. So then the problem becomes a biochemical problem. Mm-hmm. And if we manage to get hold of the biochemical problem, maybe then we have an easier way to go to the deep down soul problem. Mm-hmm. But the time isn't at that point yet that I can overview that. So no chance that I can give an intelligent answer, mm-hmm. A person always has a good reason to become an addict.
Yeah.
And every addict has a different reason.
Mm-hmm.
Although they are somehow, it is a collective thing and it is a personal thing. And in this whole diversity, we are all equal, mm-hmm. deep down. Yeah. And psychedelics, I think, can sort of take the diversity and the uniqueness into the same chapter.
Okay. I think we'll leave it at that then.
Yes.
Thank you so much.
Thank you. You're welcome. I hope I haven't gesticulated too much.